Hi everyone, joining you for this presentation are Associate Professor Camilla Pastel and
Dr. Kirsten Panton.
We are the coordinators for the Graduate Certificate in the Diagnosis and Assessment of Fetal Alcohol Spectrum Disorder, offered nationally and internationally for the first time in 2021 at the University of Western Australia. We are both academics as well as practicing clinicians. Dr. Panton has training in clinical psychology, and I am a practicing clinical psychologist and neuropsychologist. Through this brief presentation, we will talk to you about this graduate certificate, hopefully answering any questions you have about why you should enrol in this course and learn more about fetal alcohol spectrum disorder, from here on referred to as FASD. Before we begin, we want to acknowledge that UWA's campus is situated on Noongar land and that Noongar people remain the spiritual and cultural custodians of their land and continue to practice their values, languages, beliefs and knowledge. So why should you be interested in learning more about FASD? FASD is the leading preventable cause of developmental disability. And although knowledge about FASD as a diagnostic term among health professionals is relatively good, the knowledge of core features is less prevalent. This suggests that there is a need for additional psychoeducation and resources to be provided to improve prevention, identification, and intervention for FASD. The broad aim of this course is to provide graduates trained in psychology, speech pathology, social work, occupational therapy, physiotherapy, nursing, and medicine, including pediatrics and psychiatry, or other relevant disciplines with the specialist knowledge and skills required to participate in a team-based assessment for FASD. This graduate certificate is the only one of its kind in the world, and clinicians can join from anywhere in the world. This course aims to upskill clinicians to assess and diagnose FASD through an academic, i.e. coursework, which is online, component, and a clinical, i.e. practical component. The academic component aims to provide students with the necessary theoretical and empirical foundation for FASD assessment and diagnosis, drawing on current scientific and clinical knowledge. The clinical component focuses on the practical skills required for interdisciplinary or multidisciplinary clinical practice. You will also be invited to consider the views, goals and support needs of those with lived experience of FASD. Through this course, you will develop your oral and written communication skills in both academic and clinical contexts, through communicating with professionals from other disciplines and with clients and their families within a cross-cultural context. The technical skills needed to carry out relevant discipline-specific assessments will be developed throughout the course, particularly in the practicum unit. Students are required to work within the discipline and as such will only be required to develop assessment skills in discipline-relevant assessments. For example, language assessments for speech pathologists. By the end of this course, graduates will be able to complete discipline-specific assessments for individuals presenting for a FASD diagnosis, prepare appropriate reports, effectively coordinate with members of other multi or interdisciplinary teams, and get experience in working within agencies that provide FASD diagnostic assessments. As mentioned earlier, there is an academic and clinical component. Each unit is worth 6 credit points. They run in a non-standard teaching period. We have provided a rough timeline here. These units need to be completed consecutively and run one after the other with a mid-year break, approximately 4 weeks. The 3 coursework units provide in-depth knowledge of FASD concerning characteristics across the lifespan, common comorbidities, current theoretical accounts and issues, national and international diagnostic criteria, differential diagnoses, assessment tools, and multidisciplinary team assessment. Although there will be greater focus on the Australian Diagnostic Guide, the content will be delivered flexibly and from an international perspective. The content will be designed to be applicable to students within their cultural and local context. These units are run entirely online. The final practical unit provides training and experience in FASD diagnostic assessments. As you'll see here, the dates are to be confirmed, as this can be completed during a teaching period of your choice following completion of the coursework units.
We tend to get a lot of questions about the practicum unit, so I wanted to be clear about what the practicum actually involves. The unit will give you hands-on experience with FASD diagnostic assessments. Ideally, this would include you delivering diagnostic assessments relevant to your discipline, but may also include some observation as well. I've included the learning outcomes here, as this really does guide the structure of the practicum unit. Essentially, as displayed through these learning outcomes, we want you to be involved with the FASD diagnostic assessment, whether this is through the observation or the delivery of diagnostic assessments. This unit will be assessed through placement activities, so being involved in the assessments, being involved in case conferences, or perhaps writing part of the diagnostic report. And then you'll be required to write short logbooks about the cases that you see. Peer supervision is run once a month, which involves sharing your experiences about 1 to 2 cases with the rest of your cohort. This is run online. We often get questions about contact hours for the placement and supervision, and put simply, the practicum is determined by the number of cases, not number of hours. So we require a minimum of 6 cases to be seen, but this may involve your participation in 6 separate assessment days, or you may be involved with clinics where 2 to 3 clients are seen in one day. So you may even get a few more than 6 assessments completed. I wanted to share a testimonial from one of our alumna, Elizabeth, who's a speech pathologist, and she's very kindly provided her experience of the course, which is also on our coursework page. The opportunity to complete the graduate certificate in the diagnosis and assessment of fetal alcohol spectrum disorder was an opportunity to fully understand the condition, presentations, assessment and intervention process guided by the evidence base. Hearing from some leading professionals in the field from across the world and individuals with FASD helped us as psychologists, occupational therapists, speech pathologists and nurses to face the practical issue of FASD. I have benefited from knowing the strict criteria of differential diagnoses and referral pathways to holistically benefit the individual and those working with them. I hope this will lead to empowering people to realise that they may have access to supportive services to help them figure out how their brain works, rather than expecting them to cope with these behaviours and barriers to living an independent life. I would recommend this course to anyone willing and able to learn more about FASD. This course supported my work in the Kimberley to both understand the process of assessment and the means to support individuals' intervention and story. I also wanted to share some of the outcome data we have collected about the course. This course started in 2019 and we have collected data from the students that have finished the entire course to date. We asked students to complete a pre- and post-knowledge survey. Students' correct responses increased from 59% pre-course to 95% at the end of the course. Students also strongly agreed that the course has motivated and inspired them to learn, stimulated curiosity, supported and developed their analysis and critical thinking skills, and was engaging overall. We also have industry partners, experienced clinicians, caregivers, and individuals living with FASD teach into the course. A FASD diagnosis can have a significant positive impact on a child, adult, or family living with FASD. It has been important to us that their viewpoint is accurately represented. One adult contributor left our students with this message. People with FASD need these trained clinicians to do the work alongside them to create a new paradigm. Make no mistake the importance of what you are undertaking. In applying for the course, it is important to consider whether you meet the admissions requirements. You will notice that you will need to be able to register with your professional body specific to the country that you practice in. For psychology students in Australia, you need to be provisionally registered at minimum, which means that you can't apply after third year honours without provisional registration. These admissions requirements are on the course page, including a link to the application portal. I wanted to finish with some FAQs, which include some of the questions that I'm most frequently asked by students. As noted earlier in this presentation, students can join from anywhere in the world, so you don't need to be in WA. The coursework units are run entirely online. Students are encouraged to join live, but these lectures are recorded, allowing flexibility for busy working clinicians. I often get asked how many hours you will need to work on the course each week, but this is partly dependent on the pace that you study. In terms of actual scheduled time, there is 1 2-hour lecture per week in each unit, and the practicum unit has 1 monthly peer supervision session. As also mentioned earlier, the practicum is competency-based and again is not contingent on the number of hours. The practicum is organised at a location close to you, and telehealth alternatives will be offered if needed. The course load is part-time only. That is, you are only completing 1 unit at a time. However, the course can be completed over 1 or 2 years. So that is, you could choose to do 2 units in the first year and 2 in the second year. Any questions about course fees need to be directed to Ask UWA, so I have provided the link here. The course also has Commonwealth supported places, and I would also recommend having a look online to find out more about that. There is also a link on our course page directing you to scholarships that are relevant for this course. We are also hoping to launch micro-credentials in 2021, which will provide interested students with the foundational knowledge about FASD and draws on content from this graduate certificate. If you'd like more information about micro-credentials more generally, feel free to follow the link provided here. Thank you for listening to this presentation today. Please don't hesitate to get in touch if you do have any questions about the course, and I sincerely hope to see you in our course in the future. Thank you.